Hey guys, it's Lori again. I just got back from my follow-up 1-week post-op appointment regarding my spinal cord stimulator implant. The doctor checked my incisions out. Everything looks good. He put new bandages on there. And I also met up with the rep from St. Jude, which is where my device and materials are from. And I absolutely love these reps from St. Jude. They're wonderful. They explain everything thoroughly. They show you how to do everything, and then they adjust your the settings and everything on your machine. And that's exactly what we did. We kind of went over some of the settings I got previously at the hospital, and we added some more. So what I'm going to do is I'm just going to show you my back real quick. I'm not going to show you the incisions because they're covered with fresh bandages, but maybe tomorrow or the next day I'll do another video and show you exactly what it looks like underneath the incisions. I just kind of want to keep them clean for another day. So here's the incisions here. Try to get the glare out. I don't know if you can see my back or not. Let me try to switch this around here. I don't want to get a glare. Let me see if you guys can see this. I don't think you guys can see that. Okay, well, I'm sorry. I'm gonna have to I'll just show you my incisions in like a day or two whenever I take the bandages off, because I have no staples. I don't have any stitches. I just have I guess I'm just like bonded together with that medical glue they use for surgeries nowadays. So yeah, I have nothing. The doctor even said I could take my bandages off whenever I want and I'll be good to go. But I just feel more comfortable keeping them on maybe another day or two. Alright, so I'm going to show you all the materials that you need when you have a spinal cord implant. Okay, I'm just going to turn the camera away and I'm going to explain everything, what it is and how it works. Okay. Alright, so first of all, this right here, this is the actual device. This is the actual device that you use, that you actually put up to your body. You use that and you put it up to your body. And I already explained all the different settings on this. This is the St. Jude device. This is what I use anytime I'm turning it on, changing my settings, etc. And it came with this fancy case, so you could keep it in there. And there's just there's a little cheat sheet right here, and then just the information from one of the reps from St. Jude. Alright, so that's that. That's the actual device that I already explained about in my last video. And this bad boy right here, this is your charger. This is what actually charges your implant. But just so this ain't confusing, in order to charge this to your body, you have to charge in order to charge the implant. I'm sorry, in order to charge your implant, you have to charge this device here first. In order to do that, you have another plug here. I know it's confusing, but it's really cut and dry. This is the actual plug right here that you use. You just plug it into the wall. It's all tangled up because it's brand new right now, but you would just plug it into the wall, and then you'd plug this end into the front of this, and then well, this wouldn't be in until you charge it to your body. Okay, so what you would do, you'd have the charger for your implant. You'd plug this into that. Let me make sure okay, so you'd plug that in there, and then you'd plug it into the wall. And my rep, he suggested always having it plugged in. He said always keep it plugged in, that way you never forget, and it's always charged whenever you're ready to charge your implant. So let's say I plug this into the wall and this device here is fully charged. Now I unplug this, and now I want to actually charge my implant. That's when I go over to this device. This is similar to the actual, you know, this device here. I don't even know how to refer to that. That's the actual, you know, controller. So this device here has its same end, but the end of it is like this. So you would to charge your implant, what you would do is plug this part in. It's just going to take, it's hard with one hand. I'm going to set the camera down. Sorry guys. Alright, I'm new to this. I just got it. Alright, so I plugged that in the top. Okay, and there's just all these settings here. All these are just lights indicating whether it needs charged, whether it's in charge, whether it's being charged at the moment, or whether it's dead. So if it's dead, that means you need to go back and plug this device back into this. Alright, so now, if say I want to charge my implant right now, because he suggested doing it weekly, I would just turn this on. Okay, all these lights are coming on. And then I'm going to take this other end, and I'm going to put it to my hip, which is where my implant is. Alright, and it's going to pick up on it in a minute. See? It's picking up on it. There's the green light. That just means it's charging right now. So I'm literally charging my implant as we speak. And he said you should do it once every week. I'm going to take it away, and I'm going to show you what happens when I take it away. I took the end piece away, and now it's turning orange because it's telling me that I'm not charging it no more. Okay, so he said the worst case scenario is that you should, if you run completely empty, if this thing's not fully charged, okay, if that's not fully charged and it runs empty 100%, it would take 3 straight hours to charge your implant. Which really ain't that much time, but it is. That's why you should do it weekly. Just to be on top of things, to be proactive. So yeah, this machine is actually the charger for your implant. You have to keep it safe. You know, don't let it get damaged. And my implant is a 10-year implant. I'm very pleased to have a long-lasting implant that will just guide me for the next 10 years. So the most important thing is charging this. And then charging it, putting the end piece of that, which is this, to my site, to my implant site, to charge it. Now you can do that when you're reading a book, watching TV, laying down. This week, since I'm in recovery, I'm only on day 7 recovery, I'll charge it every day because I'm going to be resting a lot. I'm in a lot of pain right now because I just got back from the doctor's. So I just wanted to share that info with you guys. I hope it helps. I hope there's somebody out there that can relate to the situation I'm in, or is about to have surgery and you don't have any info and you kind of want to know what to expect. If that's the case, go back and go through my videos. I don't know, the first one I made was on the trial, when I had the trial stimulator. And some of it might help you. I mean, I was pretty new at this. I didn't know a lot about it. And I'm still learning as I go. But if you need more information, go back to my earlier videos where I talk about the trial stimulator and how it works, etc. And then I talked about pre-op, and then now I'm talking about post-op. So I'm 1 week post-op. I'm going to make a video soon to show you guys my incisions, the site, what it looks like, and how it's healing. The doctor said it's healing really well. I was so happy to hear that. And I'm very optimistic for to live a pain-free life, or at least have some of my pain reduced. Right now I'm in recovery, so it's hard to say what my pain level is because of my incisions. So that's it for today, YouTube. I hope this video helps somebody, and I'll talk to you guys later. Bye-bye.